Hi everyone, Prasan, Umi, Yazwan. We are from Group C under Prof. Asma Abdullah and we are going to present acute labyrinthitis. What is labyrinthitis? It is an inflammation in part of inner ear called labyrinth with hallmark symptoms of fever, vertigo, tinnitus, and hearing loss.
This is the structure of labyrinth. It consists of cochlea and a vestibular system that is made up of semicircular canal, utricle, and also saccule.
The etiology for it such as trauma, viral and bacterial infection.
What is functions of labyrinth? It is for hearing carried out by cochlea and as well as for balance and image stabilization by vestibular organs. There are two types of labyrinthitis, diffuse serous and diffuse suppurative. Diffuse serous labyrinthitis. It is a diffuse transudative intralabyrinthine inflammation that causes reversible hearing loss if treated early. Causes are viral, trauma, and ear surgery such as stapidotomy.
The clinical features are vertigo, nausea and vomiting, nystagmus, low-grade fever, and profound hearing loss. We treat this condition in a conservative approach, starting with early admission, hydration therapy, analgesia, antipyretic, and labyrinthine sedatives.
Diffuse suppurative labyrinthitis. It is pyogenic infections of the labyrinth that can result permanent hearing loss. Causes follow serous labyrinthitis, chronic otitis media with cholestystoma or mastoiditis, surgery or trauma to labyrinth. Route of infection such as tympanogenic, meningogenic, hematogenic. Clinical features are vertigo, nausea and vomiting, nystagmus, toxic appearance, and otorrhea. Treatment for conservative such as early admission, IV antibiotics, labyrinthine sedatives. Primary intervention for surgical is mastoidectomy.
Investigations for acute labyrinthitis are full blood count, blood or swab culture and sensitivity, pure tone audiometry, fistula test, BSER or play audiometry as well as imaging.
Diagnosis for acute labyrinthitis. Positive fistula test indicating vertigo and nystagmus.
Pure tone audiometry indicating profound sensorineural hearing loss.
And HRCT of temporal bone.
The complications are intracranial such as meningitis and brain abscess,
Intratemporal such as petrositis and mastoiditis.
and extracranial complications such as subperiosteal and parapharyngeal abscesses.
In conclusion, labyrinthitis is an inflammatory condition of the aortic capsule. Predisposing factor for it includes bacteria and viral infection. Hallmark symptoms are fever, tinnitus, vertigo, and hearing loss. Treatment is typically symptomatic and primarily involves the use of vestibular suppressants. Usage of intravenous antibiotic is for diffuse suppurative labyrinthitis. Take-home messages. Acute labyrinthitis is an ENT emergency case. Diagnosis is supported by history, physical examination, and clinical investigations. Early referral to tertiary hospital is required.